Healthcare is one of the fastest growing industries in the world, and Lehigh is looking to the future. According to the Bureau of Labor Statistics, employment in the healthcare field is projected to grow 16% over the next decade, adding about 2.6 million new jobs to the economy, more than any other field. The new Integrated Business and Health program prepares students to become leaders in this ever-growing industry. The 4-year inter-college interdisciplinary program focuses on the combination of business principles and an in-depth knowledge of health and health policy, empowering graduates to thrive in the global health market. Healthcare is about helping people, but it's more than just treating patients. It's about supply chains, business management, finance, and technology. Lehigh's IBH program will train a new class of leadership in these fields and open the door to exciting career opportunities. The IBH integrated program brings the best of business and health together and prepares students to make an impact in a high-demand field.
Hi, everyone. I'm Beth Dolan, Dean of the College of Health at Lehigh. I want to welcome all of you and thank you for joining us for the 4th session of our 6-session Population Health Colloquium series focused on the business of health this year. So the College of Health has hosted the annual Colloquium series since we opened in 2020. Each of our series has celebrated a milestone, initiative, or goal for our college. This year's Colloquium series celebrates the new intercollegiate program, Integrated Business and Health, which you just heard about in the video. That program is a collaboration between the Colleges of Health and Business, and we welcomed our first cohort in the fall semester. I know that several of the students are in attendance, so just shout out to them. We're happy you're here. If you missed our first 3 sessions in this series, they're now available on the College of Health YouTube channel. They were all really great conversations, so I highly recommend them. We also hope that you'll join us for our next session on March 5th from 12 to 1:30. That upcoming session's focus is Understanding Healthcare Finance Today, featuring Lehigh alumna Kendall O'Brien, moderating a panel of leaders in healthcare finance who are also alumni or alumni of Lehigh, including Denise Valtashek, Christine Shira, Mark Keim, and Josh Raskin. Before we get started with today's session on transforming healthcare through leadership, I want to offer a few housekeeping notes. First, we invite you to enter questions into the Q&A tab at the bottom of your screen at any time during the panel discussion. Since we're celebrating a new undergraduate program, we're going to try to answer student questions first. Of course, we don't know you're a student unless you tell us. So if you are a student, please just state that in the text of your question. So it's now my honor to introduce an incredibly accomplished panel of healthcare leaders who have joined us today. Just listen closely and you'll hear just how accomplished these leaders are. So I want to start first with our moderator. Dr. Patricia Stephenson, MD, is a board-certified obstetrician and gynecologist who devoted over 20 years to clinical practice. She served as the OB/GYN department chairperson of Grandview Hospital and was actively engaged in clinical research trials as a principal investigator. In 2005, she joined Cigna Healthcare, where she was able to pursue her passion to improve women's health and reduce health disparities. As a medical officer, she led physician operations for the U.S. commercial healthcare segment and was clinical lead North America, Cigna Global Health Benefits. Pat developed and supported Cigna Global Health Benefits clinical medical management teams in Europe, Asia, and the Middle East. Pat was also Cigna's National Medical Officer for Health Equity before her retirement in 2022. Pat was a member of the inaugural class of Lehigh's 6-year accelerated BA MD program, earning her undergraduate degree from Lehigh and her Doctor of Medicine at the Medical College of Pennsylvania in Philadelphia. I'm honored to say that Pat is also a member of the College of Health Dean's Advisory Council. So now I'll introduce the panel members, starting with Rick Anderson. So Rick Anderson has served as the President and Chief Executive Officer of St. Luke's University Health Network in Bethlehem, Pennsylvania, since 1985. He has overseen St. Luke's evolution into one of the larger health networks in Pennsylvania and Western New Jersey. St. Luke's operates 16 hospital campuses with 23,000 employees and more than 350 outpatient locations in 11 counties. St. Luke's also has the largest network of trauma centers in Pennsylvania. Rick was the 2024 recipient of the Steven Schroeder Award for Outstanding Healthcare CEO. One of the healthcare industry's most prestigious individual honors, the Schroeder Award recognizes a hospital or health system CEO who has demonstrated courageous and ethical leadership in addressing the twin issues of affordability and quality of healthcare. During Rick's tenure, St. Luke's has received hundreds of national awards, including consistent leapfrog safety A grades and CMS 5-star ratings, as well as Premier's 100 Top Hospitals recognition for 13 consecutive years. In 2021, University Hospital in Bethlehem was determined to be the #1 teaching hospital in the United States. In 2025, the U.S. Department of Health and Human Resources ranked St. Luke's first among the top 3 highest performing health systems in the U.S. for safety, quality, and patient experience. St. Luke's University Health Network includes the Lehigh Valley's first and only regional medical school campus in partnership with the Lewis Katz School of Medicine at Temple University. It also operates the nation's oldest continuously operating school of nursing and is a member of the Children's Hospital Association. Rick played a major role in establishing the Bethlehem Partnership for a Healthy Community, an award-winning national model of over 200 community partners collaborating to improve the health outcomes in the greater Lehigh Valley. In 2010, the Board of Trustees of St. Luke's named a 500-acre tract, including a new hospital campus, the Richard A. Anderson campus. Rick is currently the longest tenured healthcare system CEO in the United States, according to Becker's Hospital Review. Rick has been recognized within the Lehigh Valley for his leadership and charitable endeavors, including volunteer work as co-chair for the Hispanic Center's largest fundraising effort. In 2025, the Bethlehem Chamber of Commerce awarded Rick the Frank Marcon Award for Distinguished Business Career and Community Service. Lehigh University has also recognized Mr. Anderson for his service to the Bethlehem community and Lehigh on several occasions. Rick earned a Master of Public Health in Healthcare Administration at the University of Pittsburgh and a BS in Community Health at the University of Illinois. In addition to being a friend to Lehigh, Rick is a Lehigh parent. His daughter graduated from Lehigh with both a BS and an MBA, and his son-in-law also graduated with an MBA. Thank you so much for joining us, Rick. Doug Hock is the Executive Vice President and System Chief Operating Officer of the Children's Hospital of Philadelphia, or CHOP, joining the organization in 2016. As a core member of the CHOP leadership team, Doug provides leadership, direction, and administration of clinical operations, digital and technology services, and facilities development. U.S. News & World Report has ranked CHOP among the top children's hospitals in the country since the rankings began in 2007. In 2025-26, U.S. News & World Report ranked CHOP the #1 children's hospital in both the Mid-Atlantic and in Pennsylvania. In addition, all specialties at CHOP are ranked in the top 5 in the country, with the Department of Pediatrics ranked #1 for 10 consecutive years. Newsweek ranked CHOP #3 among pediatric hospitals on its 2025 list of world's best specialist hospitals. Additionally, Forbes included CHOP on the list of America's best large employers. Doug previously served at 2 other nationally respected children's hospitals, Texas Children's Hospital and Children's Health in Dallas, where he served as the president and chief operating officer. He has been named by Modern Healthcare magazine as one of the 25 top COOs in healthcare, and by Becker's Hospital Review as a COO to know. And I'm certainly happy to know Doug, as are others at Lehigh. Doug received his BS in Business and Economics from Lehigh University and his Master of Business Administration from the Jones Graduate School of Business at Rice University. I'm grateful to learn from his perspective as a member of the College of Health's Dean's Advisory Council. And next, I'd like to introduce Audrey Meyers, FACHE, who is CEO Emeritus of Valley Health System. a nationally recognized regional healthcare system serving northern New Jersey and southern New York. During her 45-year career with Valley, she held key executive leadership positions in strategic planning, management, operations, and governance, and has a deep knowledge of business and healthcare. Named president and CEO of Valley Hospital in 1999 and system president and CEO in 2003, Audrey served as a member of the governing board throughout that time and now serves as an honorary trustee of the system board and a trustee of the Valley Hospital Foundation. As CEO, Audrey was responsible for the strategic and day-to-day operations of one of New Jersey's busiest hospitals, ranked among the top hospitals in the state by the U.S. News and World Report, including as one of the nation's best hospitals by Newsweek, and in the top 2% of hospitals nationwide as one of America's 100 best hospitals by Health Grades. She also oversaw a busy home care agency and an award-winning medical group of close to 500 physicians and advanced practice providers across 50 specialties and multiple locations. Audrey led the organization through a very successful debt offering to support the construction of a $900 million state-of-the-art replacement hospital on a new 40-acre site in Paramus, New Jersey. As part of the ribbon-cutting event for the new hospital, which opened on April 14, 2024, Audrey introduced her recently published book, A Privilege to Serve, which tells the story of Valley and the journey to being one of the region's premier health systems. In her role as CEO Emeritus, she focused on the transformation of the prior hospital campus in Ridgewood into a robust ambulatory care campus. Under Audrey's leadership, Valley has thrived as one of the few highly successful standalone hospital systems in the country through the development of key strategic relationships with leading national healthcare systems, fostering a culture of service, performance, and high reliability, and driving a rigorous system-wide approach to margin enhancement through growth and cost control. Audrey is the recipient of the 2024 Lifetime Achievement Award from the New Jersey Hospital Association and was recognized by RO1 New Jersey as one of the top 3 female leaders and one of the most influential individuals in the business world on the Super 60 Power List. She holds a Master of Business Administration from the Wharton School at the University of Pennsylvania and is the recipient of the 2025 Alumni Achievement Award from the Wharton Healthcare Management Alumni Association. We in the College of Health count ourselves lucky that Audrey is a member of our Dean's Advisory Council. So as you can see, we have brought some really remarkable people to the table to talk about leadership in healthcare. Each of them has led a very complex organization and a very mission-driven organization. So I will turn it over to the moderator, Pat Stephenson. I'm keen to learn alongside everyone else. Thank you.
Thank you so much, Dean Dolan, and thanks everyone for joining what I'm confident will be an insightful and inspiring discussion. I'm honored to be leading this group of accomplished, successful healthcare executives who've navigated a path to the C-suite. Let's start by learning about each of your professional journeys, which perhaps were straightforward or maybe not. Maybe you took a little bit of a different, interesting path that you would like to share with us. So Audrey, how about we start with you first?
Great. I have an easy, straightforward path. After I received my MBA from Wharton, I joined Valley in the planning department. I actually was the entire planning department at that time. And I had the privilege of a career in the organization that, as you heard, spanned 45 years, 25 years as president and CEO. So starting in strategic planning really provided a great introduction and overview of Valley, as well as providing me, as this young person straight out of getting my MBA, access to all levels of leadership, the executive team, trustees, members of the medical staff. I began assuming additional responsibilities within a relatively short time, including operational roles and management experiences, first becoming a director and then within 6 years becoming vice president, then chief operating officer, and ultimately, as you heard, serving as president and CEO of both the hospital and health system. So I was able to achieve this professional advancement throughout my career without actually having to leave Valley. That's not necessarily typical, although I think Rick shares some of that similarity with me. You know, in more recent times, in order to move in your career, you're looking to move out of your organization. I felt very fortunate that I was able to gain additional responsibility while staying at an organization that I thought was, you know, a great privilege for me to be serving there. So I retired in early 2025, and now I'm CEO Emeritus. I continue as an honorary trustee of the Health System Board. I'm serving on the Hospital Foundation Board, and I continue to serve on the Board Strategy Committee so I can continue to see how our organization remains successful. So that's my quick, pretty quick path.
Great, thank you. Doug, what would you like to share with us?
Well, I have a non-traditional path to where I am. I was an accounting major in the College of Business at Lehigh. And so, like many of my classmates, began my career in public accounting, where I did audits of various companies, including many in the healthcare space. So that was really my first exposure to healthcare. I found it interesting from a business standpoint, not even kind of thinking about mission. And that, you know, when I was ready to kind of take the next step in my career, ultimately started at Texas Children's Hospital in Houston, where I was an assistant controller responsible for various accounting functions. At that point in time, my aspiration was to be a chief financial officer. And, you know, after spending a few years there and kind of feeling like I was maybe stuck, you know, had begun thinking about my next move. However, fortuitously, was offered an opportunity to lead the business office, which these days they call it revenue cycle. Back then it was a business office responsible for billing and collection for patient services. It was not something that I sought. It was really an unexpected opportunity, and I took it. As I got into it, really became exposed more to the operations of the hospital, more exposed really to the mission of the organization and the impact that Texas Children's was having on children and families in the community, and really found it, you know, very rewarding. And then what transpired over the next 19 years was a series of lateral moves that you know, really began to cause me to shift my ambitions from being a chief financial officer to being a chief operating officer. Towards the end of my tenure there, I had done some soul searching. I got my MBA, and decided to stay within the children's hospital space, again, because of the impact we were having. And I had, at that point, had my own family that had come along. And that's what took me to Children's Health in Dallas, where I did serve as a chief operating officer for 10 years. As I was kind of winding down there, thinking about the next step in my career, the opportunity at Children's Hospital of Philadelphia arose, and I jumped at it. CHOP is one of the premier children's hospitals in the United States, and it was a tremendous honor to get this role. It also brought me back to my hometown of Philadelphia, which is great. Got to see the Eagles win Super Bowl a couple times, and maybe one of these days we'll win another one. We'll see. But anyway, it's a circuitous path. I would say the one thing I would say to anyone thinking about their careers on this call is, don't always think about career growth as being a promotion. Sometimes it is a lateral assignment that helps broaden your experience. The second piece is be prepared to take a path that maybe wasn't part of your plan, because it may take you on a different journey, but one that can be just as rewarding as maybe the one you thought you were going on. So with that, Pat, I'll turn it back to you.
Thank you so much. When did you return to Philly and join John?
2016.
2016.
Yeah,
Thank you. Rick, your turn.
Thank you. Great to be here. Welcome to all of the individuals, students, and others that want to learn a little more about leadership. I think we got if I do say so, a great group of people with varied experience and an understanding of leadership. You know, leadership is a pretty important issue, but that's not what you want to hear about now. I'll tell you a little bit about my background. Went to school in the Midwest, was in varsity sport, kind of sharpened my, what would you call it, my competitive juices, even more than they probably should have been. Wasn't sure what I was going to do at the time. Remember, this is back in the very late 60s. I looked around, and with good advice from some of my mentors at the school, my professors, they suggested that I look in healthcare. I wasn't sure if it was going to take the business route or I was going to take the public health route. At the time, there weren't many schools that trained you, educated you in healthcare administration. And most of the schools were public health. And so I applied to a few, got put on a few wait lists, got into the University of Pittsburgh 2-year program. I was, believe it or not, I was an experiment. At the time, they wanted you to have experience working in a hospital, which is what we had in those days. Didn't have that, but they said, we'll let you in with another student and see if you can move from the experiment into being successful. So I get out of school after 2 years. I'm all excited. I can do anything and accomplish anything that you mentioned. Of course, I'm being facetious. And what I found is people would say to me, believe it or not, back then, nobody was politically correct. You don't have enough gray hair. You don't have any wrinkles. You're too young. You have no experience. Who's next in line for this job? So bumped around a few jobs early on, recognizing early on that, and I think that's true to Doug's statement, you got to take different jobs to move through the, I guess you'd call it the chairs of leadership. I worked in a small hospital in Western PA, and then I received an opportunity to be the CEO of a very small hospital in the Pittsburgh area. Stayed there a few years, said to my wife and my daughter, hey, we're going to have to move. We moved to New York City, Staten Island, actually, worked there for a couple of years. And then I came to Bethlehem, 1985. So you can tell from what I said, I bumped around a lot. Throughout the whole process, I wasn't old enough. I didn't have the experience. And these things were told to me, didn't have enough wrinkles, blah, blah, blah. And what's my point in telling this story? Not to feel sorry for me, but you're going to get lots of opportunities that you think are really good, but you may get turned down. And those are always, I look at as not problems, they're opportunities. You know, it's not how many times you get knocked down, it's how often you get up. So I came to Bethlehem. I told the man that hired me, hey, I'm only staying 2 years. I'm going to move on, and I'm going to be the CEO of a, I don't know, hospital like St. Luke's. I'm here for 2 months. That man walks into my office and he said, we're going to merge with another system. And I said, you know, naively, as a young person in my 30s, you didn't tell me about that. And he said, well, do you want to be the president of this hospital, St. Luke's, or not? And I said, well, sure. So here I am. I'm still here. And, you know, you don't learn leadership at school. You learn leadership over time, and it's not a science. What's the basic line I'd leave you with as I turn this back to our moderator? It's treating others as you want to be treated. That's what really the essence of leadership is. And it's probably the most important element of business. It's highest in demand and it's shortest in supply. So with that, I will turn this back.
Thank you, everyone. So US healthcare expenditures approached 5 trillion last year, accounting for more than 18% of our country's gross domestic product. From primary care to life-saving emergency treatment, healthcare providers, the healthcare system provides essential services to people in need and jobs that require a wide range of skills and expertise. As such a large and impactful industry, healthcare faces a host of challenges, from delivering high quality and equitable care to managing and securing data and supporting its workforce. Beyond that are challenges stemming from government agencies seeking to increase their influence over how that money could be better spent, and a growing number of disruptors from outside the industry. Hospitals and healthcare systems are challenged by maintaining continuous operations, keeping patients safe, and ensuring their data is secure. Those challenges come at a significant cost in terms of hiring the right people, deploying strong technology, and making clinical and business processes efficient without compromising quality of care. What's more, healthcare institutions must do their work while responding to an ever-changing regulatory environment and facing new kinds of competitors that promise patients more convenience or less costly care. So as I just described the current milieu, who'd like to start us off by describing what your role as CEO or COO of the health network involved, and maybe some day-to-day examples of activities and how you met those challenges. And Doug, why don't we start with you?
All right. Well, I think you did a very nice job painting a picture of what's going on out there. And obviously it's a really complex world. And so in part of my role, first of all, we are a mission-based organization. Our mission is built around patient care, research, and education. And so above all, what we need to be sure is, as an organization, we are living up and moving towards our mission. So I'm involved in the development of the strategies that are designed to support that mission. Determining what are the ways in which we make that mission a reality. And then in my role, responsible for ensuring that the areas that I lead move forward in implementing strategy. I think key to this, it's no matter what level in the organization you are as a leader, job one is having a great team working for you, because things are so complex. It can't be the genius and 1,000 helpers. It's got to be having a highly capable team. And that's where I spend a lot of my time, both with the leaders who report to me, who are all executives, and then talking about, who's reporting to them and so forth. In addition to having that team in place, it's then creating the conditions, the culture, the approach to ensuring, high quality services are being delivered, that our care is safe to the patients we're serving, great patient and family experience. And that's only realized through, strong employee engagement and a culture that's really committed to, that's transparent and always committed to doing the right thing. So those are some of the things that I do as part of my role.
Great. Rick, what would you like to add?
All right, I'm off of mute, I assume.
Yes.
Yeah, my thoughts and my observations are, certainly based on a collective experience that I've had. So first thing I as I've learned over the years, I didn't just drop out of graduate school and have these things. These are things that I've evolved. The people and the relationships in the organization are the most important thing you have. Those are the things that make it all come together. Keeping the organization simple, and minimizing bureaucracy, making timely decisions. I call these organizational values. And then integrity. As Doug said, you don't want to be right. You want to do the right thing. then quality and cost. Because as you spoke earlier, Pat, healthcare, $5 trillion business. Oh my goodness. If you looked at the healthcare costs as part of the GNP of a country, I think healthcare is number 4 in the world. I think we have in the United States spend more on healthcare than I think Germany. I could be wrong. Somebody will fact check me, or France, than their GNP. So that's a huge expenditure of funds, and in some cases, half of what we receive comes from the government. We don't have socialized medicine. We're a capitalistic country. I'm not complaining. I think that's good. I think our healthcare system, if you could call it that, does a really good job of taking care of people. Then you need ingredients to mix into your secret sauce. And I would probably list 4 or 5 of them. So you need talented and experienced leadership. So under your organizational values are your ingredients. You need a good organizational structure. That's what the CEO and the leadership put together. You need financial stability and appropriate use of your resources. You need momentum, and that's built through success and sometimes failures. Your failures don't define who you are. They help you become better. And then you have momentum. I said momentum and opportunity, prudent risk taking. You have to be agile and flexible. I listed that as organizational values. And then you have to have a good strategic plan. Audrey talked about her learning her craft, being in the strategic planning area. That's so important. Then you have quality and cost and service. And you've got to have some passion. You just don't sit there and just be a rag doll to things. You've got to really feel what you're doing. And then the last thing that makes it all come together is your culture. And if you have a good culture, your employees will respond and they'll show you how good they are. And those are the things that you asked me about, the organizational values and the ingredients, part of that secret sauce, the culture and those relationships. That's what really makes it all happen.
Thank you so much, Rick, for those comments. I couldn't agree with you more, and I really appreciate the fact that you called out not being afraid of failure. I think if you are comfortable, you're not doing a good job. You need to feel a little uncomfortable about what you're doing sometimes to be able to stretch and innovate and think a little differently. And certainly that goes to who you have on your team. You don't want a bunch of people just like yourself, or you might as well just be your own committee of one and have all the answers, which you don't. It's all about who you hire and diversity of thought.
And
I'm sorry, go ahead, Rick.
I was going to say, what we always say here is make the damn decision. And if it's wrong,
Right.
we'll fix it. We'll fix it. Nobody gets punished for taking the initiative. We fix things really well when we do make mistakes.
Great. Audrey?
Well, everyone said everything, but maybe what I could do is I'll summarize it a little bit and talk about, as CEO, the role is, setting the strategic vision with the board. You're ensuring the organization's operational and financial success. You're serving as the primary leader that engages in external and community relations. And as we all know, this is a very highly regulated industry. You're making sure that you're compliant with all state, federal, and CMS regulations. And very important in the role, I felt in my role as CEO, and I believe the others do as well, was really overseeing patient safety and the quality of care that we provided, establish and maintaining, and Rick talked about it, our organization's culture of caring and service, which for us really were the drivers for everything we did, and recruiting and retaining the best people to ensure that the organization would be healthy and successful. And I think we all said it, being a leader is not done in isolation. It is working with and motivating people towards a common mission, vision, and shared values. So I hope that kind of encapsulated some of what we heard.
I think so. Thank you. And I think that's a great transition to leadership skills. In the description of this colloquium, it talked about leadership skills. And so Rick, why don't I start with you? If you could maybe just name, and I think you did already, but add on to a few essential leadership competencies, maybe how you acquired them, an example of how you utilized them.
Sure, happy to. By the way, you're doing a great job of keeping us focused and on point. You know, everybody's looking for a cookbook, and there is none. Successful leaders follow different approaches. Depends on the organization, you know, depends on the people, the culture. But leadership principles are similar. Leadership's about being authentic, your own person with your own unique style, aware of your weaknesses, not necessarily your strengths. Leadership's about responsibility. It's not your rank or your privilege, your title, or even the money. It's not about style or image, charisma, or emulating great leaders. You've got to be yourself. I always tell people, be who you are. Or even conforming to organizational norms. Leaders serve their constituencies simultaneously. Who are they? Patients first. But you got customers, employees, communities, suppliers, and there are no trade-offs. I mean, you've got to do that. As I said earlier, it's the most important element of business. Can you learn it in school? A little bit, but you got to get bumped around. And leaders deliver. When we sit in front of the rating agencies, S&P and Moody's, and we're selling bonds, we're tax exempt, of course. I always tell them we're like the Domino Pizza Man. We deliver. When we tell you we're going to do something, we deliver. What counts is performance and results, but not at the expense of the relationships. You just have to tease out the qualities. You got to reinvent yourself regularly. Forget yesterday and certainly learn to forgive. Don't castigate people for making mistakes. That's just not how you get the best out of people. You've got to praise people sincerely. I could go on, and I don't want to, take too much time, but there's probably 30 or 40 principles I could cite off the top of my head that are important, and I'm happy to expound on those later, but I want to give others a chance.
Thank you. And to that point, Audrey, if you left anything, I think you did, but.
Actually, I decided I wanted to focus in on one leadership competency that I think is really important, and maybe one that we don't always think about, and that is resilience. It's the ability to navigate adversity, adapt to uncertainty, and really to be able to bounce back from any setbacks, all while keeping your team and staff focused and motivated. It combines emotional intelligence, being composed under pressure, and being proactive and optimistic in the face of change and challenges. A resilient leader is able to turn those challenges into opportunities for growth and fostering a culture of a high-performing organization. And I know we talked about giving personal examples, so I'm going to give you what I think is the best example for me personally on resilience. And resilience for me was never more evident or needed than the planning for our new hospital, which Beth had mentioned. We moved from Ridgewood to Paramus to a new 40-acre campus. It took 20 years. It was 20 years in the making because originally we were trying to stay in Ridgewood. And it turned out that we had an opportunity to acquire enough property and to move to Paramus, the next town over. So that journey actually really began again in November of 2019 when we broke ground on our new hospital. And then COVID-19, which started really as a trickle at the end of that year, became a pandemic. It was a tsunami, especially in the northeastern part of the US. And Valley was in the thick of it. And what did we do? We responded with innovation. We responded because we had community support and resilience across the entire organization to see us through. So Beth mentioned I wrote a book as part of our ribbon cutting for the new hospital. I called it A Privilege to Serve, which is how I feel about my work and time at Valley. I described the years between 2019 and 2022 as Dickens wrote. It was the best of times. It was the worst of times. Here I was getting to do something that most healthcare executives never have the opportunity to do. And that was to build a hospital from the ground up on this beautiful 40-acre campus. And at the same time, I was leading the third busiest hospital in New Jersey and Jersey was very hard hit by COVID. And I was leading it during the COVID pandemic. So that's why I was saying best of times and worst of time. And the building project, what that did for us, it allowed us to move through some of what was the most challenging times of caring for our community in my entire time at Valley by keeping us focused on something that was very positive, and that was being able to open a new hospital that was going to be employing all of the latest innovation. And we did learn from COVID. I mean, there were some very important key takeaways that as we were managing COVID, recognizing that we needed more isolation rooms and how we were going to handle supply chain and what have you. So we did learn from that negative experience, and I talked about that. You have to learn from challenges. So resilience as a leader really requires you to maintain a positive outlook, a clear sense of purpose, and a commitment to your team. That's, I think, describes, this leadership competency.
Thank you, Audrey. Well stated. So, Doug,
certainly agree with the competencies highlighted by Rick and Audrey, and I'll add two to the mix. First, leaders are in an organization for a purpose, which is to help get things done. And so one of the things I look for in people is their willingness to take initiative, to not wait to be told what to do, but to actually kind of figure things out, to fill a vacuum if one exists. And I find that really, looking for people that demonstrate that from the front level, from frontline management, all the way up into the executive ranks, is one of the key things that I think that helps with organizational success. Now, that initiative has to be balanced. You can't just be kind of a bull in the china shop, so to speak. You have to have kind of a collaborative spirit to accompany that, because just as you want to get things done, everyone else has things they want to get done as well. So there's kind of a balancing competency there. The second competency I'll focus on is influence. Very rarely in my role am I telling people what to do. Certainly working with doctors, and Pat, you know this more than any of us, doctors don't like to be told what to do. And so the way you are effective in a healthcare system is through your application of various influence techniques. And the one thing I'll comment on is no matter what level in the organization you are, you want to be working on your ability to influence others. But the expectation should be, as you are ready to move to a more senior level, you become increasingly sophisticated in the kind of things you employ to influence them. When I got to CHOP in 2016, our inpatient hospital was full, above 100% occupancy, with no plans to expand and no momentum behind needing to expand. And so I had to then begin to convince my boss, the chief executive officer, the board, that we needed to invest in new facilities. That was a process that required a lot of influencing, because these were, obviously I work for the CEO works for the board. And so being able to build the case and ultimately figure out exactly what we needed to do required a lot of thought, a lot of planning in order to get there. And so that has served me well, and I think I imagine that it served Audrey and Rick well in their careers as well.
Thanks, Doug. And honest, I have no idea what you're talking about with doctor behavior. So, thank you very much, everybody. According to an article in Healthcare Business Today, the most significant issues facing U.S. healthcare include high costs that burden families and individuals, access to quality care, and disparities in health outcomes among different populations. The U.S. is experiencing a demographic shift that is adding considerable stress to the healthcare system. Statistics show that the U.S. population is older than it's ever been, and it's going to continue to trend older in the next few decades. By 2050, Americans 65 and older are projected to represent nearly 25% of the population, and an older population requires more care. In addition, doctors are retiring, and they're not being replaced. We have a deficit of primary care practitioners. The U.S. has entered a season where healthcare demand is rapidly outpacing healthcare supply. A key fix for this issue is finding ways to encourage aging Americans to prioritize their health. Technology can empower patients to track their health, understand its implications, and tap into programs that promote better practices and could keep them healthier. Studies clearly show that the effectiveness of the U.S. healthcare industry is on the decline. Patients' needs and expectations have shifted, and the industry hasn't kept up, in my opinion. Improving the system's overall performance and consequently the nation's overall health will require steps to increase affordability, accessibility, and patient empowerment. So these are massive challenges in an ever-changing landscape. I have to tell you, I was preparing for this, obviously, and this morning I opened my phone, I hit my Amazon app, and I wanted to purchase something. I got to scroll through a bunch of options, look at reviews, check prices, clicked a button, and I'm pretty sure my new air fryer is going to be here Saturday morning. My husband, who is having a minor elective outpatient orthopedic procedure on Monday, has been fielding a number of phone calls over the same few days. His insurance company did a prior auth, and initially they declined the authorization because they said his provider was out of network, which he wasn't. We know he wasn't, and things had to be sorted out. At the end of the day, everything is fine. He's scheduled after filling out multiple forms and getting multiple phone calls from nurses and pre-op people, and you know the drill. We've all experienced it. And at the end of the day, I turned and said to him, "So what's your deductible?" I was just curious. He has a new Medicare plan this year. And he looked at me and said, "I have no idea what this is going to cost." Fascinating. Right now, I'm not necessarily equating his experience to mine, buying a new piece of kitchen equipment, but healthcare is so complex, right? Multifaceted and complex. So panelists, how in your role are you working to meet these demands and transform the industry within your role, right? What leadership attributes, or maybe it's innovation, it's AI, it's technology. How can you help us out here? Who would like to start? Rick and Audrey, you're on mute. We're all.
I'm happy to start, and you brought up AI. I think AI has incredible potential to help with the efficiency of what we do, and actually do it in ways that alleviates burnout for the providers, which I think is a huge issue. There's a concept that many of you may be familiar with called ambient listening, where the system is actually listening to the interaction between the physician and the patient. Then using large language model technology is able to translate that conversation into a note that can be posted to the electronic medical record. We track what we call pajama time, which is a time that physicians spend at night finishing their charts, which is an incredible burden on them. They don't get paid for that time. And so ambient listening is intended to help that. And it's, I think, just a small snippet of what potentially this technology could help us with. It also highlights, I think, the need for us to bring talent into the industry. And this is one thing I'll laud Lehigh for, with the integrated program between the College of Health and College of Business. Because, all those things that you're talking about, Pat, that need to be solved is in an environment where it's increasingly hard for health systems to get paid for what we do. And so the need to manage our costs, manage our finances has never been more acute. And so we need people that have the business acumen to help partner with people that have a clinical background, doctors, nurses, and the like. That's the only way that we as health systems can continue to move forward to try and address what are really pretty daunting challenges.
Thanks.
I'm happy to jump in, and I'll first start by saying I retired, but seriously, one of the things that we worked on, I think you spoke to it, is the importance of having access to your system, access to the hospital, access to your doctors. And we made a significant investment in access and navigation because we believe that's the start of it, having people be able to access your services. Other things that we worked on, and Doug mentioned ambient listening. Of course, we're working on that as well. That should help. We are in all settings looking to have staff work up to the maximum of their license. So a nurse practitioner working to the top of their license, doing things that then free up other people. So if the NP works up to his or her license, it frees up potentially the physician. We are moving also to a new electronic medical record. We had disparate systems, so they didn't always, it sounds like your husband's experience, didn't always talk to one another. So you had to go to one system for hospital, one system for the medical group, and we're going to be changing that in the coming years across both the hospital and the Valley Medical Group. And I think we'll reap some benefits to that. So I'll pass it to Rick.
Thank you, Audrey. Your question, Pat, is a challenging one, but call me a contrarian. I think what we in healthcare, and probably even as a country, and I'm not certainly talking politics at all, I don't think we give our healthcare systems enough credit, and I'm not talking about St. Luke's or anybody on this call, for all the wonderful things we do and how we've improved Healthcare is, we all know, is a very, very complex process. We don't have a healthcare system in this country. We have a series of different communities, different states with different cultures and different beliefs and different this and different that. But at the end of the day, healthcare people are really, really special. We mentioned COVID, and I don't want to get into the specifics of it, but we do a lot of things in healthcare that is really special. And so what do? We listen to the media, we listen to social media, and everybody feels guilty that we're not doing the right thing. I totally disagree with that. We're all blessed in this country. We have different issues. I'm not saying everybody gets treated always the same, but in healthcare, we do a damn good job of taking care of people. And the most important thing we all do, we have in common in this so-called healthcare system, is the patient. And there's not one doctor, not one nurse, not one caregiver that walks into that room to develop that relationship with patient and says, I'm going to do a bad job. They go in there to do their best job. And I think we've got to start praising ourselves and feeling good about what we do instead of talking about some of the negatives. And again, I'm not taking you on, Pat, and saying you're wrong. I'm just throwing out a different point of view. I think healthcare in this country is awesome. The not-for-profits, just not to toot our horn in Bethlehem, we don't pay taxes. We have a small profit margin, but we here in Bethlehem at St. Luke's, we give away $440 million a year in charitable care. And I would say that all the hospitals, whether in Jersey or New York or wherever you are in Pennsylvania, also do their fair share of giving away free care. Let's celebrate that a little bit. Let's stop the criticism that we should have done this better or that better. I said earlier, how about praising the healthcare providers and the nurses who risked their lives and the doctors who risked their lives during COVID and what they did? They were the heroes and they still are. So I'd rather focus on the more positive as opposed to the negative. We will, as an industry, figure it out. We'll get it right. Does it happen overnight? No, but we will figure it out and we will be better a year from now than we were last year. So that's my speech.
Thank you for that, Rick. I'd like to turn to some of the questions that have come in. So here is one. It's inspiring to hear this panel, and thank you for sharing your career journeys. For someone aspiring to grow into a C-suite role, what certifications or professional credentials would you recommend in addition to traditional college or an MBA? And I'll open it up, anybody, whoever wants to jump in.
I guess I would start by saying getting that master's is, really a help. I understand there are other certifications and there are people who do, say, executive MBAs who are already in the workforce. But if you're just starting out, I think having a strong foundation in your education is very important. And to the extent that your education can include not only learning about, healthcare and the healthcare system, but really learning all the business schools, because running a healthcare organization, be it nonprofit, which many of us are, requires all of those business skills. So that's really my strong encouragement.
What I would add to that, because I agree, I think having some background in terms of some of the broad business principles is really critical for success in the C-suite. But the question is, how do you get from here to there? And when you start out your career, you typically are more specialized in what you're doing. And then when you get to a C-suite level, you're more of a generalist in terms of your leadership. And as I kind of described, I think there's many paths to get to an executive level. And so part of is finding an area where you think you can thrive and be successful, and whatever certifications, background, education are necessary for you to be successful in those initial years. focus on that. And then, if you are interested in leadership, opportunities will arise in whatever area that is. And obviously, there's a lot of material out there that you can read about leadership and obviously study the leaders around you to see what you can learn from them. And just think about it as, more of a marathon rather than a sprint. This is going to take a while to get there, and there's opportunities to make progress along the way.
Thank you. So this is a timely question. Your roles vary, but I wonder how you all view the role you play as leaders in your organizations to protect and ensure access to healthcare for our immigrant communities. What are you doing in your organization to protect our basic human rights to have access to healthcare? And from a business standpoint, directly impact margin?
I'm going to jump in. We have a community care clinic, and it is accessible to everyone. And we provide care regardless of somebody's immigrant status or ability to pay, and that has always been the way we functioned. And I think that is really important, as I think a gem in our service area, providing this healthcare, that's part of our mission.
Yeah, it's Rick. I would say people are people. It doesn't matter if you're an immigrant. It doesn't matter if you're born in this country and have lived 100 years. You take care of our patients. That's what you do. That's what we're here for. Patients are the most important. And, lots of people talk quality. Lots of people want to be politically correct. I respect that. Again, it's not about the politics. If you're a not-for-profit, and I'm not speaking of the for-profits, I'm not speaking ill of the for-profits. I mentioned earlier, every not-for-profit is required by law. That's our responsibility to provide charitable care to our group. And it doesn't matter religion, skin color, belief, creed, whatever. In all of your mission statements, I guarantee in this country, you'll find that statement. I do believe that the media and some of the hype that's gone on has overplayed that. And I believe if you went into our hospitals in our country, our not-for-profits, and you looked, you would not find, there's always room for improvement, but you would not find the kind of, quote, discrimination that the hospitals are accused of. I do think we do a good job, but there's, again, always room for improvement. You need to be aware that there are those that don't have that kind of access, and you have to try to help that. But I refuse to let this contentious environment that we're in bring us down and make us feel like we're not doing a good job. I feel just the opposite.
Yeah,
I'm going to just jump in if I can. We are in a unique part of the country. I mean, I think we just need to recognize that when you look at who you're speaking to, you're hearing from New Jersey, Pennsylvania organizations where healthcare may be is more accessible. And I think there probably are parts of the country where care is impacted by some of the changes that have occurred for safety net hospitals and the like, where people are traveling great distances. So, Rick, I agree. If you can make it to those hospitals, I agree they're going to provide the care. But I do feel like there are probably areas where it's not quite as seamless or easy as it is in our area.
We can't change that. We can only control what we can control. We have safety. We have a safety net hospital here. I can speak to that, but I can't fix California or Nevada or Utah. But I certainly can control what happens here in our service area in Eastern Pennsylvania.
And I don't disagree. I just wanted to be sensitive to the question that was.
Doug, you were going to say something?
Well, I think just, kind of echoing some of the comments made. I mean, our primary place of care is City of Philadelphia, which has among the highest rates of poverty in the country for big cities, and we have historically been committed to being good neighbors to everyone that is in our community, and certainly we're going to continue to focus on that, and we have a number of efforts focused on social determinants of health and really understanding some of the things that might lead to disparities in the way care is being provided, and so that has been part of our focus and will certainly continue to be.
Thank you. Another question: how is your organization embracing AI? And I know we touched on this a little already, but what, in your opinion, are opportunities in using AI to benefit both financial management and patient outcomes and satisfaction?
So, go ahead, Rick.
No, certainly you go, Doug. You got it in there first. I'll go next. Thanks.
Well, we do see broad application across the system, and I mentioned the ambient listening, which is focused on the clinical environment. We are working on automation work. So some of the disparate systems that you mentioned, Pat. Right now it sometimes requires manual intervention to get information from one system to another system. So figuring out ways to automate that to, again, help with efficiency. There's just huge opportunities there. In the research space, some of these machine learning models, I think, have huge potential to help, sift through, potential drugs that might be beneficial that we might want to trial. I'll again put a plug for those of you out there who are going into fields like data science. There is just enormous opportunities in the healthcare space, and which is one of the reasons why, as an organization, we're very much looking to partner with Lehigh to help bring some of this talent on board to help us with what we're trying to accomplish.
Rick?
Yes. I'd probably take more of a wider purview. My job as the person that controls a lot of the resources here is to lower those barriers for those internally that believe certain AI applications can help us. My counsel always is, and I'm certainly no expert. Doug's probably 3 levels above me in some of the things he described, and I mean that in a complimentary way, Doug. I don't want to be the first to try some of these AI applications, because indeed we're in a trial and error period, just like we were probably 10 years ago in IT. Everybody wanted to be the first on the block to get it, and then 6 months later, just like your phone, it's an upgrade, and oh my goodness, I learned all this and it doesn't apply. I think the same thing applies with some of the AI applications. We use them in radiology. Are we the leader? No, thank goodness. But are we in the middle of the pack? Yes, we are. And we don't turn our nose up and say, we're not going to do this, but we certainly don't want to be the last one to apply some of these things. So we try to take the approach, if it makes sense, it's pragmatic, it's not exorbitant in price, and we can adapt as we go, then we'll make sure we do it. And people at the appropriate levels can make those decisions. I don't sit and deliberate or pontificate, tell people what they need for their jobs. I let that up to them. My job is to get them the resources and encourage them. If they make a mistake in the judgment or the application, we'll fix it. We'll move on. So I kind of take that middle of the road and use it when it makes us better. And the question always is, will it make us better? Sometimes there's not an answer, so you dive into the pool.
Well, Rick, we do aspire to be more on the leading edge of adoption, but going back to your earlier point that it doesn't always go the way you want, and what we say here is progress over perfection. We had to pull the plug on an agentic AI application, a chatbot that we had implemented. It just wasn't working the way we thought, and the failure associated with that is something that comes with the territory if you are striving to be kind of leader in the adoption of some of these new technologies.
Thank you. So as we wind down here, any final thoughts, Rick? Maybe now that you have the wrinkles, you want to describe anything that gave them to you, or any final thoughts from any of our panelists? I'm not picking on you, Rick.
That's okay, Pat. I'm used to getting picked on. I think I'm going to take my picture off the screen so you can't pick on me.
No, I would do.
No, I do believe in healthcare, and I started out, and it's a perfect segue to get out. Leadership is essential to any success in the organization, and leaders are so important. And earlier on, the question was, how do I get to the C-suite? I didn't chime in at the time, but it's true for anybody. You want to get into an organization that has good people with good character, that have good values, and money is not the most important thing. It's being around good people, and then the monetary rewards will come. And I think character and commitment is the key. If you get in an organization with people with good character and commitment, people that you can trust, and you say, well, I don't want to go here or there because these people are too quirky. I want a team that are quirky, and they'll figure it out. But you need to have the help of good leaders to how to win as a team. To win as a team, it's not about me or you; it's about us. So that's kind of my closing comments. Leadership is it's an odyssey. You never get there. It's always you're moving forward, but you can only do it if you have a good group of people around you can trust, and trust you, and watch your back. Healthcare is the ultimate, like football. Doug mentioned earlier about the Eagles. By the way, I think they have a great team, and they'll win in the future. This is coming from a Pittsburgh Steelers fan. But healthcare is the same as like a football team. That's the ultimate team sport, football. And healthcare is the ultimate organizational team sport. It really is. It is so complex. So you got to go into it with that. There's no easy answers, and there's always something to do the next day.
Pat, if I could add on to Rick's closing thoughts, as people are looking for the kind of organization they want to join and what that next step might be for them, and they're evaluating their current organization or a new one, I always suggested to people that what was most important in making that decision was whether it was a good cultural fit. Did the culture of the organization, which to me, culture drives everything, is exceedingly important, and sharing the values of the organization. So I think as people are looking, are they going to move? That to me would be something to pay a lot of attention to make sure this was, the organization that you were going to share the values, you were going to work alongside people who bought into the culture, who look to serve the patients and the community.
Terrific.
So I support everything that Audrey and Rick said, and I'll add one additional last thought is, healthcare has never been more challenging. Certainly, the country is facing some significant challenges, but with challenges, with chaos comes opportunity. But I'll also say that to me, and I would actually stand this up as a competency. each of our own ability to manage our own well-being is going to be key to our success. And so having the support system that you need to stay healthy, both mentally, emotionally, family, friends, exercise, sleep. I know for some of you that may be hard to come by at Lehigh as you burn the candle from both ends. But I mean, to me, managing our well-being is one of the things that we should keep in the forefront of our focus, because that's essential in order for us to be able to lead these complex organizations.
Thank you so much, everybody. And I'm going to turn it over to Beth.
Thank you guys so much for a really interesting conversation. I think I really appreciated the insights that you have, both for what it means to be a leader of a mission-driven organization like the ones that you all lead or have led. And also I appreciated the conversation among the 3 and 4 of you, which was really very interesting too. So we really appreciate you. People hung on, for the full hour and a half, a lot of people, which is a great sign. So anyway, we enjoyed it, and we'll say goodbye now. Thank you so much, Pat, for doing a masterful job moderating. Yeah. All right. Bye. Thank you.